Okay, let's take a look and see where we're at with Eric here. If we look, if you can zoom in on that, Harry. Okay, especially in his lower front teeth, what I'd like you to see is, and Eric, actually if you can tip your head down a little bit, it might be a little easier for Terry to really get a sense that those lower front teeth are pretty nicely aligned now. They're not, they're not completely aligned, but you'll see there's a little bit of spacing where we did a very slight amount of interproximal stripping. Now, on the upper anterior, so what we actually ended up bracketing was from number 21 through 28, and on the upper from 6 through 11. And essentially, the upper is probably almost completely aligned as it is right now. And as we would expect, bite down. Right now, Eric is hitting a little heavy on his anterior teeth as a result of the fact that we really haven't brought those lower front teeth back. Right now, they've been essentially aligned, and we have a little bit of excessive spacing now between them. Our next step will be to, again, to consolidate those spaces. And as they do, those lower front teeth are going to come back a little bit. And then when that's completed, and again, we're at 5 weeks right now, we should be completed with this in about another 6 weeks, I would say, Eric, okay? And at that time, we have then eliminated or taken care of or addressed the issue of the constricted function. We will have then essentially brought the relationship between the upper and lower front teeth such that the lower front teeth will be back, or the upper anterior teeth will be forward of where they were, essentially being out of the envelope of function. Now, when that is done, we still have the issue of the dysfunction. In other words, as your jaw comes forward and repostulates or repositions itself, we still have the issue where all the back teeth may not be hitting evenly. So when we are done with the orthodontic phase, what we will then do to complete Eric's treatment will be to probably equilibrate, probably very conservatively, and then also we may need to very slightly fine-tune the linguals or the inside of those upper front teeth, upper anterior teeth, to finalize that relationship between the incisal edge of those lower front teeth and the inside of the upper front teeth, okay? The orthodontics is going to get us very close. It's going to get us very, very close to our final objective. And then we refine and idealize with a little bit of equilibration and a little bit of restorative treatment, probably on the inside of those upper front teeth, okay? So we'll leave it there with Eric, and we'll probably be back in another 6 weeks or so when Eric should be pretty much done then. And Eric, just tell me, before we leave here, how have you been doing? How has this gone for you?
The braces have been real easy. Everyone always talks how painful they are. They're really not. I've been eating normal. It took a little bit of getting used to, which is fine. And I'm noticing more people in the world that have braces. So we've been talking a lot too. Okay. And migraine-wise, I had 3 small migraines. They weren't a full week migraine, which was very good.
Okay, and realistically, understand that whole issue, and one of Eric's primary concerns was with regards to the migraine and the head pain. Right now, because Eric has not been in the deprogrammer, that's been gone and out, basically without the deprogrammer, your back teeth are still functioning or hitting in a way, your teeth are still functioning in a way that I wouldn't expect a complete remission of those headaches or a complete improvement of the biomechanic problems we're concerned with here, really until we're done with treatment, okay? So kind of like the fact you're doing as well as you are right now, I think is a great indication of things to come.
Today was the first day I woke up with no jaw pain, no neck pain.
Good.
No pain whatsoever.
Yeah. And I think we'll find, and we'll follow up on this, but I think you're going to find as we go along here, it's going to get better and better, especially once we get to the end and really refine all those little relationships that are going on. Again, excellent. We're taking care of the front teeth now. When the front teeth are done, we'll refine those posterior teeth, and everything should be real happy.
Great.
Okay? So we'll see you back in about another 6 weeks. Thanks, Eric.
Thank you.